Hello everyone, welcome to the Academy. Yes, so please comment about the audio visual so we can start the session. Yes, as per your request, we are coming with the English version of the our previous NEETflix session episode number 1. Yes, we are launching our NEETflix episode NEET in a minutes with the mnemonics with the super high yield most forgettable topics in the most easiest way. Yes, this is your NEET PG previous year question. You can read and type in answer in the chat box. Yes, so now we are looking on the mnemonics for the von Willebrand disease. This is our first episode topics. Yes, so in the recent NEET PG there is a questions about the types of the von Willebrand disease. Yes, there is a type first, second and third. How you remember the every features of the von Willebrand disease? Yes, just imagine the story of the three person first, second and third. Yes, just imagine this photo, this just imagine this story of the three person. Yes, so first person, second person and third person. So third person bearing the weight of second and the first person. Yes, so the first person is the most common position because the first person having no weight of the any other person. She is feeling very free, so most common position is first. So most common type of the von Willebrand disease is the first type. Now, so the third person is bearing weight of the first and second person. So by wearing the weight by wearing the weight of the first and second person, third person feel very difficult. Yes, his situation is very severe. So this type third person means type third von Willebrand disease is very severe. Yes, due to weight of the first and second person, third person may go deleted. So the mutation in the third person, mutation in the type third von Willebrand disease is deletion. So you can remember type third is a more severe von Willebrand disease. Type third is a deletion type of the mutation, and you can see the first and second person are dominating in the third person. Yes, first and second person are dominating in the third person, means type first and second are autosomal dominant inheritance, but type third is a autosomal recessive inheritance. Yes, when you look toward the second person enjoying the in the between first and second person. So obviously quality of the second person is bad. Yes, so second type person means the type second von Willebrand disease is qualitative defect, but type first and third is quantitative defect. As you know, the third is most severe, so third is complete quantitative defect, but first is partial quantitative defect. Yes, so this is all about types of on the von Willebrand disease. There is a Weber Pallade bodies secreted found in the endothelial cell. Yes, megakaryocyte secrete the alpha granules. Yes, that used for the adhesion, and that the von Willebrand factor are plasma carrier for the factor 8. Yes, so if you look at the blood coagulation profile, there is a bt increase, there is a aptt increase, but there is a constant pt. Yes, but there is a constant pt. Just when we look at the full form of the von Willebrand disease, so Willi means von Willebrand factor, E means endothelial cells secrete the von Willebrand factor, means Weber Pallade bodies, B means BT increases. So any defect, quantitative or qualitative, affect the platelet that affect the BT. Yes, if platelet is affected either quantitative or qualitative, it directly affect the BT. So BT is increases. Now in the von Willebrand spelling, BRAND, R for restocytin, A for abnormal. So restocytin abnormal in von Willebrand disease, and D for desmopressin used for treatment. In shortly we say DDAVP or cryoprecipitate. If you go further in the depth, there is a again type of the second von Willebrand disease, second A, second B, second M and second N. As you know, the above type is dominant, the below type is recessive. Yes, and 2A and 2A and 2M has a adhesion defect, and 2B has thrombocytopenia, 2N is autosomal hemophilia. But you not need to know this in depth. Just know, just revise, just memorize this story of the three person means type of the von Willebrand disease. Now when we are looking at this person, this last year NEET 2024 MCQ previous year question, you can solve which is not a true about this disease. Yes, type 3 is most severe form in children. Yes, obviously type 3, the third person is wearing the weight of the first and second person, so third person feel very difficult, very severe. Yes, so this is most severe. Yes, type 2 type 2 means second person in between, means moderate bleeding. And then again, type first is most severe. No, type 1 is most common. Now, so type 1 is most common because type 1 first person is the abovest person is feels more free, so they choose this person most position most commonly. So we can say type 1 von Willebrand disease is most common von Willebrand disease. Yes, so we have started this series NEET Netflix NEET in a minutes. Yes, and we will take such important, forgettable, and previous year topics, and we will discuss with the super easy mnemonics stories in the minutes. Yes, so you can also suggest such topics which you tends to forget, tends to do wrong in the your GTs or mock test or while solving the Q bank. You can send such topic to us directly on the WhatsApp or Telegram or the comment section. In upcoming Netflix series, we will address with the super easy mnemonics. This slide we already discussed in our previous batch of the NEET PG, and exactly question coming from this. So many question directly coming from the our earlier series like alphabetic, accelerated, etc. Yes, so thanks for the participation.